Hello everyone, and welcome back to our channel. Today we're diving into a crucial health topic that affects millions of people worldwide, often without them even knowing it. We're talking about high blood pressure, also known as hypertension. It's often called the silent killer because it can quietly damage your body for years before symptoms develop. But sometimes your body does send out subtle warnings. So, today we're uncovering the top 10 signs that might indicate your blood pressure is too high. Remember, this video is for informational purposes, and you should always consult a healthcare professional for a proper diagnosis. Let's get started. Coming in at number 10 are vision problems. Have you ever experienced blurry vision, double vision, or even sudden loss of vision? These can be alarming signs related to hypertensive retinopathy, a condition where high blood pressure damages the blood vessels in your retina. The retina is the light-sensitive tissue at the back of your eye. When the pressure in your arteries is consistently high, it can cause these delicate vessels to thicken, narrow, or even leak fluid or blood. Over time, this can put pressure on your optic nerve and lead to serious vision impairment. If you notice any sudden changes in your eyesight, it's not something to ignore. Schedule an eye exam and a checkup with your doctor to rule out high blood pressure as a potential cause. At number 9, we have dizziness or lightheadedness. While feeling dizzy can be caused by many things, from dehydration to inner ear issues, it can also be a sign that your blood pressure is elevated. This sensation of unsteadiness, or feeling like the room is spinning, can occur when high blood pressure affects your brain's blood supply. It can be a fleeting feeling or a more persistent problem. Sometimes people might dismiss it as just a moment of feeling off. But if it happens frequently, especially when you stand up or change positions, it warrants a closer look. This symptom is particularly important to watch for, as it can increase your risk of falls and injury. Don't just brush it off. Consider it a potential nudge from your body to check your blood pressure levels. Next up, at number 8, are frequent nosebleeds. Nosebleeds, or epistaxis, are common and usually harmless. However, if you find yourself experiencing them more often than usual, without any obvious cause like dry air or an injury, it could be linked to high blood pressure. While the connection is still debated among experts, the theory is that the high pressure can damage the small, fragile blood vessels in the lining of your nose, making them more likely to rupture and bleed. If you're suddenly getting nosebleeds on a regular basis, and especially if they are combined with other symptoms on our list, it's a good idea to get your blood pressure checked. It's a simple, non-invasive test that can provide a lot of valuable information about your health. Sliding into our number 7 spot is the presence of blood spots in the eyes. This is medically known as a subconjunctival hemorrhage. It happens when a tiny blood vessel breaks just underneath the clear surface of your eye, leaving a bright red patch on the white part. It can look quite dramatic and scary, but it's usually painless and doesn't affect your vision. While it can happen from something as simple as a strong sneeze or cough, it has also been observed more frequently in people with high blood pressure. The high pressure puts extra strain on these tiny, delicate vessels, making them more susceptible to breaking. If you notice these red spots appearing in your eyes without any clear reason, it could be your body's way of signaling that something is amiss with your circulatory system. At number 6, we have facial flushing. This happens when blood vessels in your face dilate, causing your skin to turn red and feel warm. It can be triggered by many things like stress, cold weather, spicy foods, or exercise. However, facial flushing can also occur when your blood pressure spikes. While hypertension itself doesn't directly cause long-term facial flushing, a sudden temporary spike in blood pressure can. If you notice your face getting flushed alongside other symptoms like dizziness or headaches during moments of stress or exertion, it might be a sign that your cardiovascular system is under strain. And pay attention to the patterns and triggers of your facial flushing and discuss them with your doctor. We're halfway through our list, and at number 5 is a symptom that's often misunderstood: fatigue and confusion. Feeling tired all the time is incredibly common, but persistent, unexplained fatigue that isn't relieved by rest could be a sign of underlying high blood pressure. When your heart has to work harder to pump blood against high pressure, it can leave you feeling drained. In more severe cases, very high blood pressure can affect blood flow to the brain, leading to confusion, memory problems, or difficulty concentrating. This state, known as hypertensive encephalopathy, is a medical emergency. If you're experiencing severe fatigue combined with mental fogginess, it's a serious warning sign that needs immediate medical attention. Now for number 4. nausea, or vomiting. Feeling nauseous isn't typically the first thing people associate with blood pressure, but in cases of a hypertensive crisis, a severe and rapid increase in blood pressure, nausea, and vomiting can be prominent symptoms. This extreme pressure can affect the brain and trigger the body's nausea response. If you suddenly experience intense nausea or vomiting, especially when accompanied by a severe headache, blurred vision, or chest pain, it is absolutely critical to seek emergency medical help immediately. This isn't a symptom to wait out. It indicates that your blood pressure may have reached a dangerously high level, requiring urgent treatment to prevent life-threatening complications like a stroke or heart attack. Entering our top 3, at number 3, we have shortness of breath. Do you ever feel winded after simple activities like climbing a flight of stairs or carrying groceries? This could be dyspnea or shortness of breath, and it can be a sign of how high blood pressure is affecting your heart and lungs. Over time, hypertension can cause the walls of your heart's main pumping chamber to thicken and stiffen. As a result, your heart becomes less efficient at pumping blood, which can lead to fluid backing up into the lungs. This fluid makes it difficult to breathe. If you find yourself gasping for air more easily than you used to, it's a significant red flag. Don't just attribute it to being out of shape. It could be your heart signaling that it's under too much strain. Our runner-up, at number 2, is chest pain. Chest pain, also known as angina, is a classic warning sign for heart-related issues, including those caused by high blood pressure. This pain can feel like pressure, squeezing, or tightness in your chest. High blood pressure forces your heart to work harder and can contribute to the hardening of the arteries, or atherosclerosis. This can reduce blood flow to the heart muscle itself. When the heart muscle doesn't get enough oxygen-rich blood, it results in chest pain. Any form of chest pain should be taken very seriously. It's a critical symptom that requires immediate medical evaluation to rule out a heart attack or other serious conditions linked to hypertension. Please do not ignore it. And finally, the number 1 most talked about sign that your blood pressure may be too high is persistent headaches. We're not talking about your average tension headache. Headaches associated with high blood pressure, particularly a hypertensive crisis, are often described as severe, throbbing, and typically located at the back of the head. They are often worse in the morning and can be accompanied by some of the other symptoms we've discussed, like dizziness or vision changes. While most people with chronic high blood pressure don't experience headaches, a sudden onset of a severe headache could signal a dangerous spike. If you're having unusual or severe headaches, it's a very compelling reason to have your blood pressure checked by a professional. So there you have it, the top 10 signs that could indicate high blood pressure. The key takeaway is that hypertension is often silent. Relying on symptoms alone is not a reliable way to know if you have it. The only way to be certain is to get it checked regularly. It's a quick, painless, and simple step that could save your life. If you are experiencing any of these symptoms, especially in combination, please speak with a doctor. Thank you so much for watching. We hope this information was helpful and empowers you to take proactive steps for your health. If you found value in this video, please give it a thumbs up, and do not forget to subscribe to our channel and hit the notification bell so you don't miss our future content. Stay healthy, stay informed, and we'll see you in the next video.